week, a very warm welcome to everyone who took time off their busy schedules to participate in today's webinar. Also, a big thank you to all our frontline heroes for being there for us and keeping us safe. We are proud to have brought together some of the tech's biggest names for this production, and we hope you will enjoy it. I would now like to introduce you to Dr. Sam Shah, who is a global digital advisor and a clinician supporting governments and industry with transformation through technology. Before I pass you over to Sam, I would like to say, the World Trade Center looks forward to welcoming you all to GITEX Global and GITEX Future Stars from 6th to the 10th of December 2020 at the Dubai World Trade Center live. Thank you.
Hello and welcome to this webinar hosted by GITEX Virtual. Today we have a distinguished panel of speakers covering industry and the health sector, discussing how AI can help the economy and healthcare following the COVID pandemic. Before the pandemic, it was estimated that the global AI market could be worth about $400 billion by 2025. That's an extraordinary growth rate. But globally, we've heard lots of examples of how technology is being used to tackle COVID-19, with everything from the contact tracing apps through to facial recognition technology. In public health terms, we're now seeing testing taking place in centres such as shopping malls. Through this webinar, we'll be in conversation with some leading experts who'll be sharing their perspectives on a number of areas, including the use of big data and AI, and how governments and industry have leveraged these to help virus containment, how countries like the UAE have built a successful testing program, provide a strong foundation for an excellent economic start. And we'll be discussing how AI is enabling companies to adapt to the realities of the crisis. And then we'll explore how AI is helping organizations safeguard against assets and the realities from further shocks. Throughout this webinar, you'll be able to ask questions, participate in our polls, and use the chat function to share your ideas. Please do use the Q&A feature to direct your question at our panelists. So thank you very much for joining, and thank you to all of our panelists. So it gives me great pleasure to introduce our panelists now. I'd first like to introduce Leela Saran. Leela is currently the Director of Public Sector for Microsoft in the UAE. Welcome, Leela.
Good morning, Dr. Shah. Good morning, everyone.
Now I'd like to introduce to you Soren Charan. Soren currently drives the Artificial Intelligence Group, which is responsible for AI strategy and solutions across Hewlett-Packard Enterprise business units and the regions, working with customers on solutions, platforms, and strategy. Hello, Soren.
Hi, Sam. Good to be here. Hello, everybody. Good morning.
We've now got Dr. Min, Director of Group 42, an AI and cloud computing company, working with Abu Dhabi's health department on a population genome program, improving healthcare and combating COVID-19. Dr. Min has got more than 30 years experience in biologies and molecular biology. And before joining Group 42, he was the Dean of the Grandomics program at the Research Institute. Hello, Dr. Min. We've got Dr. Jalan, who is the CEO of HIMSS Greater China. And Dr. Jalan was previously Principal and Consulting Director for the Greater China Joint Commission International. And she's consulted with hundreds of hospitals in about 30 countries around the world. Hello, Dr. Jalan.
Hello, Sam. Good morning. Hello, everybody.
And we finally have Dr. Madhu. Dr. Madhu is an experienced Chief Medical Officer who's demonstrated the history of working in hospital and in the healthcare industry. He's skilled in mechanical ventilation, big data analytics, Six Sigma, and health information technology, along with pulmonary diseases. Hello, Dr. Madhu.
Good morning, Sam. Hello, everyone.
It's great to have you all here. And it's amazing to have this discussion at GITEX Virtual about what we're going to do with AI. I'd like to start off with a question for you all. And I'm sure you're all eager to give us your considered response. It's a real privilege today, and I really welcome you to share your expertise and your insights. So I'd like to start off with, what do you think, and how do you think data and AI-powered technology is going to be critical in the successful national-wide response to virus containment? It'd be great to hear from you, Leila, first of all.
Sure. Thank you, Sam, for the question. Obviously, the rapid onset of COVID-19 has really illustrated the interrelationship of the health system and regional and world economics. I think there's no one that can doubt that health security is actually not only affecting national security, but also economic security. One other things, obviously, that we've seen with COVID-19 is that there are gaps in health systems worldwide. And you definitely want to pinpoint those to how health systems actually gather, store, and utilize data. We know that there's a lot of data in healthcare, but we also know that much of the information needed is found in dark pools of data that are completely siloed and completely separated from each other. And the call really is, how do we create intelligent health systems that are going to leverage data and artificial intelligence so that you can create some strategic advantages and provide efficient health and medical services across all touch points really of the healthcare system and across all experiences for everyone that is involved in the healthcare system, but also that is benefiting from the healthcare system. The reality is today we live in a world of intelligent everything, and in such a world there will be no room for unintelligent health. And the way we see it is the value proposition of artificial intelligence in health, and probably in every other industry, is really around two simple things. One is, how do you automate processes? And two is, how do you augment processes? And it's really not about replacing anyone, but it's really about how do you make it much more efficient and much more intelligent in this intelligent everything world. So automating processes, I mean, from mundane tasks, repetitive tasks, but also some of the work that we've been doing with Microsoft HealthBot was really around how do we tailor this HealthBot to be specific to COVID-19 and offered it up to the CDC, to hospitals around the world to help them respond to a flood of consumer inquiries. So the bot really fielded millions and millions of inquiries of people that were concerned, of people who had questions, of basic triaging, if you will, of COVID-19 cases. If we hadn't had the bot, then humans would have to deal with millions and millions and millions of messages. And the second one, really, when you augment processes, and really probably not COVID-19 related, but when you see AI driving value to assist or augment work that is done by clinicians. Examples are in any diagnostic related process. If I think of radiology, or even in the cardiology world, being able to identify patterns very quickly so that you are able to make a first diagnostic much quicker than before, and probably in a much more efficient manner. And if I want to highlight some other uses of AI going back as well, because we talk a lot about research right now. So as Microsoft, we've created the COVID-19 Open Research Dataset, the CORD-19, which is basically a repository of more than 29,000 articles on the coronavirus family from around the world. We use our knowledge extraction capabilities to actually help medical and machine learning research communities to mine text data for insight that can actually help fight COVID-19 and hopefully help in finding a cure. Sorry.
No, thank you, Leila. That's excellent. And it really gives us an insight as to how we link the strategy together with AI in efficiency in the system. You know, I'd be great, Soren, it would be great to take your perspective on this, given your area of, that you're working on right now and how it links in really to AI.
Hi, Sam. Hey, thank you, Sam. So basically, I'll take from the HP perspective, we looked at working with customers, but we wanted to understand initially, basically to understand the virus. And in order to do that, we walked through the very beginning as from the DNA, how to actually look and how to identify the virus up to the publications, as Leila was saying earlier. So if you're looking through all the various processes on how do you fight against the virus and how do you foresee what will happen in the future, we basically aligned with our partners, customers, data science teams, basically the wider HP, looking at first DNA. How do you identify the virus? How do you make sure that you align we align our HPC resources, AI resources, partner with customer to simply just charter it out. Then we looked at identifying and seeing the virus itself. So we looked at cryo-EM techniques to image the virus. Then that's not enough because then you need to model the virus, you know, how to see all those coronas around it and so on and so forth. And then we go again into our HPC environment where we're actually helping customers and partners, again, just identifying the being able to model the virus. Moving onwards, drug discovery. So how then you realize how that you block that virus to actually go to your A2 receptors and then locking it on. So we used pharma ML techniques, and we are sponsoring pharma ML techniques to be able to help the drug discovery. Then you go to vaccine because drugs are not enough, but you want a vaccine. So then we have our data science team working with our partners simply to enhance and to look at how do you actually build, how do you make them actually, you speed up the processes for a vaccine discovery. Then obviously it's patents, because we are working closely to put all our patents out there in order to make sure that everything that we've done in AI, in data science, and so on and so forth enhances the help of the wider R&D community. And finally is the publications, as Ezra was saying. So the Core-19 data said that the various companies, including Microsoft, thank you for the data, actually allowed us to design, not only us, but the wider community to design Q&A that will help clinicians and scientists and so on and so forth in the front line, just simply by asking a question. Why did this happen? How do I triage? Who is actually at risk and so on and so forth? So if you're looking at DNA, image, model, drug, vaccine, patents, publication, you have the whole 9 yards to understand the virus and understand how to fight it in the future. But this is not enough, because we also need to foresee if a pandemic like this will actually happen before. And in order to do that, we need to understand what is the behavior of the virus, how do we actually protect better our communities and so on and so forth. And this is something where also, again, AI and big data are playing a huge role in order to determine how everything spreads, how actually, how do you protect the communities in order to let them know in advance, for example, that, you know, somebody is infected. So it's a wider effort from cities, from governments, and obviously from the commercial and the R&D environment.
Soren, that's great. And it really nicely takes us through the whole sort of end-to-end process, as it were, and nicely about how cities respond. I'd like to bring in Dr. Min at this point. Dr. Min, you've been working with the Abu Dhabi Authority. It'd be really good to take your view on this.
Thank you, Sam. Well, two previous panelists covered very large data space, as well as the end-to-end solutions, where the AI comes into the place to fight, to understand the COVID. So our role has been G42 Health in very close collaboration and guidance from the Abu Dhabi government as well as the UAE government. We have been very active in bringing new diagnostic tests to the country, also shipping out very large amount of protective gears to China, very early stage, as well as other countries. We've been sharing our knowledge as well as materials throughout the globe. Basically, as of yesterday, we shipped out one of our robots to smaller country, which can have ability to increase their diagnostic capacity. During this time, we also built one of the largest diagnostic test infrastructures outside of China. We are currently finishing up the largest ELISA-based testing units in the world, 20,000 to 30,000 antibody tests per day. All these efforts are preparing not only our country to move forward into the economic recovery phase, as China has done very successfully, we also have a strong desire to make people's life much better and comfortable as soon as possible. Within that context, G42 has been proactively in developing back to work programs, back to fly programs, also creating the types of application packages that ordinary people can use. So overall, we have been very busy as well as doing a lot of science. In that context, Sam, let me finish final sentence. We've been collecting large number of COVID patient samples as well as COVID viral samples, understanding how the genome is organized with a strong desire, as Sorin mentioned, to develop better vaccines by understanding interface between antibody and antigen world, which is completely unknown at this moment. Thank you, Sam.
Thank you, Dr. Min. I think, of course, you're quite right. But I'm really glad you mentioned the example there of China, and a great opportunity, Dr. Jalan. It would be amazing to hear from you and your thoughts, given your global role and your role in HIMSS across China.
Thank you, Sam, and thanks everybody. As we all know that the COVID-19 was first reported in China, and it took about a month for China to see the flattening of the curve once it put the full measure of shutting down and utilizing all the resources. And then as we can see that the strategies that implemented in China had been pretty successful. And then among that, being able to have early detection, early reporting, early isolation, and early diagnosis and treatment enabled that the curve flattening fairly fast. And from my perspective, I think the most effective that China has done is being able to engage the mass population of 1.3 billion. And without strong use of information and technology, that's not almost impossible with that level of population engagement. And the way that I think China has effectively used the population engagement is through a lot of online platforms to disseminate epidemic-related information, not only massively publish all the on the daily data on where cases are, how many cases, new cases, and how many deaths, how many whatever suspected cases, but also it has a very personalized features such as cases in your neighborhood, cases nearby, so that everybody on the phone could quickly find out if there's new cases in the neighborhood, or if there's cases to where somebody is traveling to. And also that there's many apps developed to allow the self-reporting for everybody. So not only you can report where you came from, where you're traveling to, and who you have contacted with, whether the contacted individuals around you have had any suspicion of infection or a confirmed diagnosis, but also you report your symptoms. So
Dr.
that,
Jalan, and that's really important about the ability to sort of report on symptoms and operate at scale. It's fantastic to hear how much has happened in China. And I'd really like to, at this point, bring in Dr. Madhu, because Dr. Madhu, you've of course got a perspective across Cleveland Clinic and the UAE. And it'd be great to hear what you're doing and what your perspective is on this.
Well, thank you, Sam. I believe both the US perspective and here in UAE, COVID has fundamentally changed some aspects of healthcare delivery, right? For one, both centers, both in the US and here, we've made a rapid pivot to virtual visits and telehealth. And I think this time around, telehealth is here to stay. We went here in UAE from 0 telehealth visits in January to now doing most of our visits and most of our encounters virtually, right? And what has been really interesting is the kind of things that we've learned. For example, there was a myth that patients wouldn't like it and physicians wouldn't like it, and this would cause a lack of connection between physicians and patients. On the other hand, what we've found is that virtual health can often increase the connection. We've heard examples of patients introducing their doctor to their grandkids and their pets and showing them their house. And so it's been an interesting experience for us. In the course of this, we've also identified new opportunities. I think telehealth and virtual health opens up possibilities for using health technologies to classify and cluster patients, improve workflow, use artificial intelligence and machine learning in ways we have not done before, such as provide patients with context-sensitive help using a bot, or even use automated technologies for translation. We've started to use the health information exchange, medical information that is in the HIE, which is aggregates from multiple entities, to start looking for ways in which we can mine data and identify new knowledge, create new knowledge from that rich data set. I do believe that this new paradigm opens up a lot of new opportunities and business opportunities and will fundamentally change how healthcare is delivered in the next few years.
That's really helpful, Dr. Madhu, and it really gives us a context of what's happening across industry and the health sector with a real global perspective. Now, most of us know that as part of any public health response, we've got to have the best sort of testing capabilities in place, especially to deal with the type of outbreak that coronavirus brings, but also to help us with economic recovery. I'd like to ask another question, and that is, how widespread testing capabilities do you think sort of underpin a safe and sustainable economic recovery? And I'd like to start off, Dr. Min, with you, please.
Sam, that has been tremendously challenging aspects of fighting against the COVID. It has been a very long time, basically since 1918. We had such a serious scale of a pandemic, basically. Basically, nobody was ready. We were not ready. So we didn't know how long it's gonna last, how many people will be infected. All the models, whether the AI models, epidemiology models, all failed to predict precisely. Having said that, people in the field have been very, very proactive, all globally. Small companies built many different creative diagnostic tools. Many regulatory agencies were very proactive in allowing emergency use applications approved in many elements, diagnostics, vaccines, many different forms, as well as the different countries, business entities, traditional life science entities, changed their production rates and then retooled their analysis kits to fit the COVID fighting need. Not only that, scientific community came together, understanding the tremendous need of open context of sharing. Global scientific community has been created. As Dr. Madhu pointed out, there's a different culture of collaboration has been created.
Dr. Martin, it'd be great to take your perspective on this.
I echo what Dr. Min said. You know, testing is going to be fundamental to how we safely open up businesses and activities. We need to know what businesses can open, where they can open, and under what conditions they can open. And the fundamental underpinning of this will be testing. Especially when it comes to travel and international travel, I do not see how we can do this safely without testing. And I want to echo what Leila said earlier about dark pools of information, especially healthcare information does not travel across international boundaries, right? There's a lot of friction in obtaining health information across boundaries. And I think we'll have to figure out some way of making this available in real time, close to real time across international boundaries. And one quick follow-up to what Dr. Min said, I think testing is going to change during the course of this pandemic from this year to maybe early next year. Right now, most of our testing is based on PCR, polymerase chain reaction, and it tests for the genetic material of the virus. Now, it's a good test, but we know that it can be false positive. We have had patients who've been positive for 20 or 30 days after the infection. As time goes on, new tests such as antigen testing, and of course, most importantly, antibody testing to see if individuals are immune, are going to become incredibly important, and also in identifying who can re-enter the workforce.
I'm really glad you mentioned testing just there, because we're going to move on to our first poll now. And this is an opportunity for everyone to give their views from out there about our poll. Our first poll is going to ask, you know, how willing are people to be tested as the lockdown ceases? And this is so important, because if we take what's happened from a public health point of view, and really at the end of the day, this is a global issue. So when we think about that data translating around the world, it really means a lot to every country as to what we get from test results and how we deal with our populations as a result of those results. And it would be great to hear from the audience really what their views are on their willingness to be tested, to help us as public health authorities in all our various roles as to how we deal with the pandemic. I know we're going to come back to various elements of this topic throughout our discussion this morning. So, we're now going to see what the poll result tells us. And if we give it a moment, I think we're going to see the poll. Wow, there we are. So we've got a yes. 75% of those participants are willing to be tested as lockdown eases, which is great. A very small minority said no, 4%, and a few, about a fifth, which said maybe. So I think that's quite telling that most people seem to be willing to be tested. That's absolutely fantastic. So with that, I'd like to move on to our next question. And really, at the end of the day, AI is enabling companies to confront and adapt to realities of the crisis and the next normal as we move out of the crisis. Leila, I'd really like to take your view on this, given your expertise in this area and work you're doing globally.
Sure. So I think, I mean, basically what we're seeing today is there's not a single industry that hasn't been impacted in a way or another by this current crisis. And I'm talking about really the economic impact here. So most organizations are being squeezed today with decreased income or eroding profitability. And if I think of the healthcare industry specifically, I think also climbing costs that are COVID-19 related. So there's a lot of talk around. Many organizations already had some kind of a digital transformation plan in place or a digital transformation strategy in place. And what happened with COVID-19 is a lot of this has been accelerated. What we've seen is actually in 2 months, we've seen in the past 2 months, the equivalent of 2 years of digital transformation across the globe and across industries. And I think, I mean, more and more people are going to rely on emerging technologies. And I would say artificial intelligence is no longer an emerging technology, maybe for some still being classified as this, because there's so much that has gone digital in those past, already over the past 10 years, but really in those past 2 months, that executives will need to anticipate a lot of the transformative power of artificial intelligence to drive what we call a digital feedback loop. That really
and I think that feedback loop that you refer to, especially as this becomes the normal, at a business point of view, has real importance. At this point, Soren, I'd like to bring you in and pose a question to you. Which business functions do you think are most at risk, and how is AI going to help organizations safeguard those assets from further shocks, really, as we start implementing AI?
Thank you, Sam. So we've been working with customers across the board, right? And what we've discovered that the first part of basically all the various segments of any enterprise were affected. So there is no one segment that was not affected. But then the hardest were, for example, impacted were the supply chain. So we've seen the supply chain suffering and struggling to keep up because simply the shortage of material, the shortage of supply chains, the shortage of people actually being able to deliver all of these to various parts of the company. That was the first thing. Secondly was on manufacturing floors. It was impossible to actually keep people at work. It was impossible to have cluster of people being together, actually doing what they do best, work, let's say, right? So we've seen, and only if you look at supply chains and manufacturing floors, you realize that if those two are affected, then it's a chain of effects, like the butterfly effect that affects all the industries worldwide, right? And in order for us to use AI in the future, we need to make sure that we are looking at, as we discussed, I think many times before, is new business model and how do we actually bring together all the various companies to actually look at how do we design the new way of in the new normal, how do we design the collaboration in between them? Second one is what are the value pools, meaning where do I actually look at how do I look at data to make sure that I'm able to extract value from for the various parts of the businesses where they were not there before. And thirdly is how do you keep your customers satisfied? How do you use AI to make sure that all of these you're in the new normal, you're able to have a functioning enterprise that allows you to use the data to keep the customers staying with you, but also to still be able to design new products, new solutions, new phenomena in the new normal where everything.
Soren, I'm glad you just mentioned there about what businesses are doing and how they respond in this way and what is the new normal. It'd be great to hear from our audience again. So we're going to move to our next poll at this point and really find out what people think out there about describing their organization's approach to AI and find out a bit from the audience about what they think around this. Because as you say, if this is going to become the new normal, and as Leila just mentioned there before, and as you're just responding about the things that are important, I guess we need to know whether or not organizations out there are really ready in terms of their approach to AI. But I certainly reflect and totally understand your perspective there around what organizations are doing and how the supply chain globally was impacted. So let's see what happened. Wow. So 54% of those that have voted said they're testing the water. Well, that seems consistent with what you've just sort of referred to there. We've got a small proportion, 15%, that say they're industry leaders, about 18% on their way to success, and 14% is still holding back. So as we get through our discussion, I'll be really curious as to how we get that 14% to progress and move on. I'm now going to move on to our next question. And I've read so much about the work that's been done in China and Dr. Jalan's work. And I'd really like to take a view from Dr. Jalan on how the internet, big data, AI, and other technologies were leveraged in China's fight against COVID-19, especially when it came to contact tracing that you mentioned earlier on, and really risk level population management. Because I know that you've done a lot there in China. I read your article recently with great joy. And especially as we move forwards, what do we do about early treatment, diagnosis, and how do we help with social distancing as industry reopens? So Dr. Jalan, I'd love to take your views on this and hear from you.
Thank you, Sam. I was just talking about the self-reporting tool by the mass population, and the AI enabled the interactive features of the self-reporting tool. So once you report it, that the app could tell you if you are at risk or not. If you are at risk, then recommend you to self-isolate or send you to the local facilities to get tests or treatment. And also, if you are not at risk, recommend you for precaution. And not only that, the big data play a big role in AI, because the AI really is based on the big data. Having the data from the travel, from the self-reporting, and from the payment transaction, that as a country and the region could predict the movement pattern, predict the concentration of the risk population, and allocate the resources effectively. And as China started to reopen, I think it's late March, April, and that range. And one of the things I thought was very helpful was to have created the health QR code, which really was for every individual who wants to travel to self-report and then identify if they are at risk or not. If they are green, then they can travel. If they are yellow, they have to be quarantined for self-isolate for 7 days. If they are red, they have to be self-isolated for 14 days. And
that seems like a really clever sort of strategic way to do it. And you know, it seems like there's a real coordinated effort there to find a way to reopen the economy by creating these really clever tools and products. I imagine you must have had some great partners working with you from industry. That sort of moves me on to my next train of thought on this. And Leila, I know that you and Microsoft have done an immense amount, both in the UAE and globally, in supporting organizations. And I'd really like to hear from you now on, you know, Microsoft has been on its own responsible AI journey, shall we say. And for some now, and how have you been helping both externally and throughout their organizations?
Yep. No, this is I mean, I think, and I've seen some questions on the chat around this, and do we trust organizations or governments to use our data or to be with our data? I think, I mean, any AI application today needs to be used responsibly, and the way we look at it is really, how do we put some principles behind any artificial intelligence application? And those principles are around making sure that it's transparent, making sure that it's reliable and safe, that there's privacy built in, and there's security that is bolted in the application, that it is fair and inclusive. But also, I think one of the underlying principles is really around accountability. Specifically, when you start thinking about AI applications where that are being used, for example, for making decisions on who to treat or who not to treat, right? So you want to make sure that you're fair, you include everyone, but also you are accountable. And all of this goes back to how do you actually design your AI application? How do you feed it with the right data? And how do you allow it to learn over time through the power of definitely big data, machine learning, obviously, but also cloud computing, and even more powerful computing, which helps in actually always improving and enhancing those AI applications. So really 6 very grounded principles that we embody, but that we also help our customers and partners across the globe also embody.
Leila, I'm really glad you mentioned there about that decision-making process, because clinically that is so important. I'm sure others in the webinar will probably resonate with that difficulty in making a clinical decision. At this point, it's probably helpful for us to think about that transformation journey in any organization. And I've certainly had my own challenges with digital transformation. Soren, I'd like to ask you, because you did mention customer experience there. And you know, with the new normal, as we accelerate digital transformation in any sector and we start going through the power of data and AI, what could we do to reimagine that customer experience and their behavior? And how do we drive new business models to become a reality? It would be great to take your thoughts on this.
Thank you, Sam. So I'll try to quickly cover that, but I'll talk a bit more about customer experience because, yeah, this is something that is really important for everybody. So businesses are exploring today the new ways to create and capture value from data. And this is something that, as Leila was saying, has been accelerating in the past couple of months like we've never seen before. As most of our companies, the companies we work with, but also individuals are shifting from compute-centric to data-centric model where data, they are exploring new pools of data, which previously they were not even looking at them. Also, they are accelerating and applying AI models faster than before. They are capturing value from data collection and getting data from all the various sources. But also everybody thinks about how do I increase the trust and the privacy if I want actually to be able to think about customer experience. COVID-19 has prompted governments to enforce social distancing policies, like for example, working from home, which changed the behavior across the industries. This basically created a virtual demonstration ground for what can be done virtually and what will actually swing back to physical. The question post-COVID-19 is what behaviors will endure and what will actually return. Not everything about the world has obviously changed forever, but businesses need to pay attention to what consumers are learning that they did not know before. Like for example, faster deliveries, or for example, remote medical sessions. Like you're going to a doctor, you're using a camera, you're not actually going to be there physical and so on. So safety and health concerns will remain post-COVID-19. Customer will be balancing freedom of choice versus safety. And we know this very well, including like various solutions that are out there on the market for example, social distancing, right? Which in order to have a good payoff across the industries, for example, like healthcare partnership and so on and so forth. And this actually brings together the idea of new business models because we need, as I was saying before, we need to come together to make sure that these things, that something like this doesn't happen again from the healthcare perspective, from the industry perspective, but also from the recovery perspective. We are going to be in a U-shaped recovery. And
that's really important because I'm glad you mentioned those 3 points just there. And it'd be, again, useful following your discussion, take a view from the audience and move to our next poll, because ultimately this is about the benefits of AI. So let's ask the viewers out there what they think the business benefits of AI are that they're looking for right now. What is it that they're trying to solve? We'll surely get a view from the audience as to what's important to them really around this topic area. Because then once we've done this, I'd love to then move on to take on some of those burning questions people got. I know we've had lots and lots of questions posed to us, and I'm sure they'd be eager to hear more of your thoughts on this topic area, which seems to, of course, driven a lot of both emotion and interest. So I wonder, I wonder really, what do our audience think about this topic? In a moment, we will find out what our viewers think. Wow, well, there we have it again. We can see that decision-making is the main thing that those businesses are looking for in terms of the benefits of AI at 38%, but not far behind. They want to optimize internal business processes. So there's something there, I guess, around efficiency. We've got customer service at 20%, but then there's about 8% who are uncertain about the return on investment. Now, I accept it's a short poll, but again, it shows to us what it is that industry is looking for in order to help us progress from this. So now we're going to move over to our audience Q&A, and I know we've got lots and lots of questions, but I'm going to start off with our first question, which is, how do we evaluate the impact of AI on the current pandemic? And how has the technology helped us to reduce the negative effects on economies and societies worldwide? Well, I'm going to start off with, I'd like to start off with Dr. Jilan on this topic because it relates really to the evaluation of AI on the pandemic. And then I'll move on, I think, to Leila. So Dr. Jilan first. I think, Dr. Jilan, you may possibly be on mute.
That's right. Sorry about that, Sam. Well, evaluate the impact of AI is and then I saw that the ROI is a return on investment, and how much are we putting in and what we're getting out. And then I think that if we look at the use of the population engagement, contact tracing, and also I forgot to mention the AI, the assisted diagnosis of COVID pneumonia, that interpreting the lung images, you can see that the rapid flattening the curve was in part the result of AI-based technologies to bring the epidemic into control and started to effectively open the economy. And then in order to have a better quantitative calculation of return on investment, I think as industry, we really need to do more of that. Yeah, we can kind of tell that by using all those digital technology, making it smarter, we are more effective, but how much do we really put in and how much do we really get out? And then I think we have to do more work to get better numbers for that.
I think I tend to agree. Leila, it would be good to hear from you in terms of the negative effects on economies and how technology from your perspective has really helped to reduce those negative effects.
No, I mean, I think, so Dr. Madhu gave a very good example, telemedicine, right? The surge of telemedicine that happened during this pandemic, not only because people were just worried about going to hospitals or worried about going to see doctors. The surge has been just amazing. Do we think that this is going to continue? I believe so, because today patients are consumers. Consumers more and more are requiring a much better experience, and definitely through telemedicine, they've realized that the experience that they're getting is definitely much better. We've seen a lot of retailers that have not made the shift to online. Today, when their shops closed, they seriously accelerated their shift to online. And even if they started with very basic technologies, they've discovered that this is probably going to be the new normal for their consumers, and they're going to continue to improve and provide more and more and better omni-channel services to their consumers. So there's a number of industry scenarios that we've seen where actually the pandemic has, I don't want to say this, but the pandemic has shaken up the transformation of these industries.
I think that's quite right around the transformation agenda. The scale is often a different thing, and it takes on to another question. And I'd be curious as to who amongst the panelists would like to answer this. How do you scale AI in the Middle East? Who'd like to take that question? Soren, I might start off with you if that's okay.
Sorry, apologies. I couldn't hear that. I lost you there for a moment, Sam.
I'm sorry. How do you think we should scale AI in the Middle East?
Well, finally to say, I've been involved in with various companies and various customers in Middle East. So basically, what I've seen happening in the past, let's say, I think something like a decade or so, was various countries in the Middle East, like UAE and Saudi Arabia and others, investing in the first thing is you need skills. So I've been looking at universities and companies investing in bringing either skills from abroad, but also more importantly, creating new programs, new universities, courses, and so on and so forth around AI. So we need the skills to come from Middle East. So first one is the skills. Then from the technological investment, we've seen a lot of smaller companies like startups actually building up, especially in Dubai, and we are working with some of those as part of our Digital Life Garage at HPE. But the most important point is first you need skills, and then you need obviously startups. But also if you look at both UAE and Saudi Arabia, for example, those governments have pledged a huge amount of investments in AI, right? In the United Arab Emirates, you have a Ministry of AI, right? It's one of the few countries in the world that actually have a ministry of AI. And those ministry of AI, if you look at the way it looked at distributing those investments across the various government bodies, is that they are always putting AI first. And we've been working with the Dubai police and some others, and we've seen this firsthand. So AI first all the time, and then basically by 2030 or something like that, they want the biggest number of programs to be funded because they are AI and so on. So so it's again skills, startups, and government funding, and we see all of this in Dubai, in UAE. Sorry, I apologize. In some other countries, we just need a bit more time.
Seems like an excellent recipe for scale. I'm going to take that one. Well, we've been talking a lot about AI, but we've also been talking about digital in this. You know, we've been asked here another fantastic question from Lucy about what plans are for integration of global health with digital health across borders. Well, I think this has to be a question for Dr. Madhu, given your global reach through Cleveland and your own experience there in the UAE.
Yes, thank you, Sam. So I think this pandemic gave us an opportunity to experience this firsthand. I'll talk a little bit about AI and our experience with AI during COVID specifically. We have several AI tools to, for example, predict a patient who may deteriorate or get worse, or septic shock, which is a very severe form of infection. And the interesting thing that we found was when we took the models that were developed in the US and tried to apply them here, we had horrible performance. So it's very clear that some aspects of AI are not portable, and we need to localize them because the patients are different, the conditions that they have are different, the symptoms are different. So this was our first learning experience, that institutions will have to develop their own internal expertise in how to develop and implement AI. Beyond that, I think there is a need to normalize the way we collect our data because there's too much difference across international boundaries on how we collect data and how we report it. In the end, I think we are heading towards an era of syndromic surveillance, right? On a global scale, we'll need some level of syndromic surveillance, not just for human disease, but also disease that occurs in those animals that we come into contact with. We've heard about avian flu. There is a Nipah virus. Coronavirus is another example. So truly an expanded syndromic surveillance. And I think healthcare data will be one important subset of that.
It takes us nicely on to the next question that I want to get to. Now, so far, during this pandemic, we've all been very reactive with our approach to COVID-19. We've had to be. Taking Tiffany Huang's question, how can we use big data and AI to implement proactive strategies? Who would like to take this question?
I can, if you want, Sam, just maybe start off a little bit, because we've been thinking about it quite a bit here in the UAE and at the Cleveland Clinic. And I just want to talk about what Dr. Gillen reported. You know, we benefited from China's experience. When this outbreak occurred in China, I believe it was during the early part of the Spring Festival with a lot of travel and migration. And it was remarkable that in January, there were papers that took the data that was present at that time and pretty much forecasted what would happen globally. It was a remarkable synthesis of data from the rail system, travel, Tencent, and healthcare, very quickly aggregated and then turned into a publication. And what that did for us here in UAE is it allowed us to proactively identify risks here and put actions in place in February. And I think this is something that we have to learn from, where we take data, synthesize it, analyze it, and turn it into public policy very quickly. And I think countries that have done it well, Singapore and China, have been very successful. And I think that's a model for other countries as well.
Dr. Molia,
If I can add here, Dr. Sam, I think, I mean, again, how do you also make sure that you are using all the data that is available to you, right? When I think of some of the vulnerability maps that we've created, using a whole amount of data, including social determinants data, right? So that you can able to locate some of the hotspots that are in your community, in your city, in your state, or in your country. I think this is one of the main use cases of big data and AI for you to combat the pandemic.
Completely. I couldn't agree. Dr. Jalan, please.
Oh, I just thought, if I may add to it, I think it's just the infrastructure building in every country, every region, about the disease surveillance and the data sharing platforms. And I think that if we were able to have a very active and broad-based disease surveillance, can quickly identify any new emerging disease and have an infrastructure to respond to it, especially with the information technology and the infection control mechanisms, and then also just collaborative mechanisms within organizations and within region and internationally.
Fantastic. Well, we've got so many questions there, and I know our panelists are eager to answer them. Anyone else like to pick any of the other questions that they've seen here before I pick one? Well, I'll start off with one. You know, the survey that was done by apparently Deloitte has shown that 3 years expected for transformation. How long do we think it will take to see transformation in the UAE? And I might start off with Dr. Min, who's obviously been working with the authority there.
So what kind of transformation will take place in which elements? That's not specific, but let me talk about multiple different angles. First of all, going back to Sorin's point about education, readiness, and training. So UAE has been very, very proactive. Particularly Abu Dhabi government created a MBGY University AI. Also, G42 has been very active in creating AI institute here. We already have over 100 scientists working on developing new models. Also, it's really government initiative, really strong leadership in Abu Dhabi government allow us to prepare our workforce for future. Secondly, in terms of the business development wise, Abu Dhabi has been extremely proactive in reaching out to new industry models, such as vaccine development programs, as well as potential drug discovery programs, reaching out very, very proactively global scale. Third element, the policy regulatory component. For example, Abu Dhabi government is building in the process of creating Abu Dhabi or UAE FDA to look at all these regulatory components, accepting, admitting clinical trials. The fourth element of science that has been very proactive research community created, which is called COVID Research Committee, National COVID Research Committee that exists. And then during this process, all aspects of needed elements have been very addressed. Most importantly, the community as a whole came together tremendously. As Dr. Gillian told about, the real engagement of a community and population scale become very, very important. I've been very lucky to work with large number of the Emirati nationals here in my genome program. Those are volunteers, very talented people called from UK study to home to volunteer. One thing I learned from them is patriotism. I do this one because it's our duty. I do this one because it's something we must do. It has been tremendously a strong eye-opening experience for me that the entire population is engaging to combat this one. It means that readiness, or preparedness is already being developed for future incoming pandemic.
That's amazing, Dr. Min. And I think that's a really nice point for us to finish on, because it really highlights the true benefits of that cultural change, that change amongst people working together to see a difference in their population and bring about transformation. And it's been amazing to have heard so many fantastic and diverse views. We haven't had time for all the questions. Certainly more questions that we've been posed with in a webinar like this than I've seen in a very long time. And I'd really like to finish by, first of all, thanking our exceptional panelists. You have been truly tremendous. Everything you're doing to fight coronavirus, from industry, from healthcare, from strategy, has been fantastic. It's been great to hear from you. And really thank you so much for joining me today for this webinar. It's been quite clear that we have industry leaders in Microsoft and Hewlett-Packard Enterprise. You're doing an immense amount to support organizations, both in their strategy towards data, AI, but also to make a difference in the processes, both for now and for future growth. And I've been really encouraged to hear from you today. Clearly, Dr. Ming, Group 42 have got an incredible amount of expertise. Your description just there of what you're doing to work with the UAE government and really to improve the landscape for genomics and AI, to improve healthcare in a community, both to combat COVID-19 but beyond, is exceptional. And Dr. Madhu, you know, I am just very lucky to have heard from you about what you're doing across Cleveland Clinic in the UAE and how you really use technology and digital healthcare and thinking about that future position to transform the health, both here in the UAE, but also globally from Cleveland Clinic. And I'm really looking forward to continuing to learn from you. And Dr. Lan, fantastic to hear about your work and the work of HIMSS, advising the healthcare sector, but really taking the very best of benefits in technology to address COVID-19. Fantastic to hear from you about the tremendous efforts that have taken place there in China and about how that will help resume services. So once again, thanks you to all of our panelists. Thanks to our fantastic audience that have been so engaging, submitted so very many questions, and really challenged us in a way to think about what we do with AI and the future and the economy. Thank you all and have a fantastic day, and looking forward to more from GITEX Virtual.
Thank you, Sam. Pleasure.
Well,
Thank you. Great moderator.
Sam, thank
Dr.
you.
Madhu, get in touch soon.